Now, there's a big new trend in America, and it is cosmetic procedures and surgeries. Everyone wants to preserve their youth, and women and men alike rush to get these things done. But there are a lot of myths and misconceptions out there, a lot of major advances, questions you've always wanted to ask. I'm going to ask them right now. That's why we're bringing in this expert on all of these things, Dr. Erfani. Welcome back to America Trends. First, I want to open the most popular cosmetic procedure, as far as I can tell these days, is Botox. They can use it for all kinds of things. I've seen it used for headaches. I have a friend who uses it for a spastic bladder issue. I'm hearing all kinds of new uses every day for any sort of muscle things, muscle contracting problems people have. What are the little known uses of Botox, and also what are the surrounding products? Because I know there are other products that emulate Botox now. Some may be safer. Tell us.
Well, thank you again for having me again.
My pleasure.
So Botox, you're right. It's wonderful. It has a lot of applications that are becoming clearer to the public now, and to the physicians who are using them. Personally, I'm finding more than multiple applications that are used for the face, other than the ones that we've classically used between the eyebrows, the forehead, around the crow's feet. Those are all classic areas. There are also other areas that can be adjusted around the lips, on the jawline. And these are applications that now more and more physicians are learning how to use.
Right.
But as far as medical applications, there are several. It's been shown in studies that Botox can actually help scar healing and scar improvement. It's used for spastic paralysis in the body for children. It's used in several applications around the body for relaxing, let's say, tight musculature in certain areas. Like you said, you mentioned your friend with the bladder dysfunction.
Right.
So there are a lot of things that Botox can help, and we're starting to find out more and more from the different specialties what the applications are that can be used. You also mentioned that there might be other products. We talk about Botox. There's also two other products available in the United States, Xeomin and Dysport. And all of these essentially are botulinum toxin, but they have different unit structures that make them pretty much the same, but you have to know how to apply them.
Right. It's important to go to a professional who's fully licensed, who has lots of experience with that. Fat grafting is the other thing I'm hearing tons about right now, and not for the things people think. Like, you originally think of fat grafting as almost like, the same things you would use other injections for fillers purposes. But there are some really unconventional and new uses for fat grafting, I'm hearing. And I'm just going to lay this out really clearly. Always wanted a nose job. Don't like my nose from the side. I watched a nose job video on YouTube and decided I could never do it, but I've heard of fat grafting being used as a sort of nose job alternative, so talk.
Absolutely. So fat grafting is like anything else, like we mentioned with Botox, finding its greater applications also. First of all, your nose is beautiful, so I don't know why you would want to do anything for it.
It's just, it's one of those really personal things.
Of
you
course,
know, you probably hear this from your patients every day.
Yes.
Sometimes it's just a thing, and that's my thing.
Right.
It's always been.
So if you were looking for a small adjustment, let's say, for the nose, let's say the angle that the nose is taking off from the forehead, perhaps a little bit of the tissue on the tip, there can be minor adjustments made with fat grafting, provided that you have the good structure already. Okay, going back just for the nose, let's say, the structure of the nose is not with bone, but with cartilage and with bone, and that with fat alone is a little bit more difficult to do. But fat, let's say, right now, there are applications for fat for buttock augmentation, which is very, very exciting. In the past, implants were used for buttock.
Which is thank you Kardashians, it's very in.
Absolutely.
Yeah.
So the implants that were used for buttock augmentation, I personally favor using fat now. Fat
So
transfers.
when you get the fat, how do you get the fat? What is that procedure? Because this is like a bona fide surgery.
Absolutely.
This is not just like an injection.
And actually getting the fat is an important part of the fat graft procedure as well, because half of the procedure for a buttock augmentation or buttock shaping procedure is actually shaping the framing or the surrounding area around the buttocks. That means reducing, let's say, unwanted fat deposits in the flanks that are making the buttock profile look higher than it actually is. It's a visual effect.
Okay.
And actually not providing the illusion, but actually removing the illusion of the buttock being that higher and shaping the butt, taking that fat that you've harvested.
Some people might just think too much, because honestly, who is that? I mean, you can't even see your own. So like, who spends that much time thinking about those I guess you have patients who
I
do.
have thought about it and studied it, yes.
One of the big things in the whole world of plastic surgery He's a
what I do.
red-blooded American male,
This is what I
okay? It
do.
happens.
Yes.
One of the big things in the world of plastic surgery, Dr. Erfani, is surgery under using a local anesthesia. I'm reading a lot about this. Some people prefer this to the risks of a general anesthesia. What is the risk and benefit of a local instead?
The reason you would entertain doing any procedure under a general anesthesia is for control. It's for controlling the situation, the health of the patient, it's controlling the safety of the patient, but it's also for controlling the pain and the comfort of the patient. It is actually safer to do procedures under local anesthesia as long as you can provide the safety and the comfort to the patient. For example, if we were to do, let's say, a facelift or an eyelid procedure, I prefer to do those under local anesthesia. I can get adequate numbing of the areas, comfort, control anxiety to the point where that's a very good way of doing that procedure.
So the patients just chill. They don't feel anything.
Well, they're awake and they're part of the procedure, but they don't feel pain.
Do they remember it?
They can certainly remember it. There can be situations where you can be put into a deeper twilight, so there's less memory of the situation. Very frequently, people will say, you know, I don't even remember part of that procedure. So there's a spectrum of activity that can be used under those circumstances to provide a safe result, a quicker result, and a more rapid recovery, because you don't have to undergo general anesthesia, which also has its own risks. There are medical risks that are associated with general anesthesia. It's become very, very safe now, but still the risk that can occur from general anesthesia can be quite severe, and even death is one of those risks, which I hate mentioning, but,
Yeah, well, it is.
this has to be taken into consideration.
Yeah, I mean, we all know about Joan Rivers.
Well, yeah, and yes.
It's just a very scary thing. So let me ask you this, because I know you're a very conservative doctor. How do you find that place where you have to tell that patient no? Because plastic surgery can be also an addiction. And I have to say that I do know people who they've just had too many. They just don't look right anymore.
Right.
How do you say no as a doctor? What's that line where you go, all right, no more?
Well, I got to tell you, I'm very comfortable saying no, because the paradigm that I follow when I practice is to really listen to somebody and see what their desire is. They're trying to achieve something through their appearance. It's a level of confidence. And if it's something that I can achieve for them, I will tell them so. If that's something I can do for them, because they're, in the end, the greatest judge of their own face, how they want it to look.
Right.
If it's something that's reasonable and I can achieve, I will offer to them. If it's something that seems unreasonable, it's something where they're on a level where I can't really understand how to achieve it for them, then it becomes very easy for me
Well, I
to
know
say,
this must be true because you keep trying to talk me out of the nose job that I
No,
still
exactly.
think I want.
No,
My
I
dad had a
appreciate your
nose job.
nose.
He's got a very Middle Eastern
Aquiline
nose, and
nose,
he
yes.
got a nose job, and his looks fantastic. I just don't have the nerve for the chisel. The chisel on a nose bone sounds painful.
Understood, understood.
Dr. Erfani, thank you so much. Tell us where we can find you.
Well, you can find me, I'm at spiritlift.com, and our offices are in La Jolla and in Eastlake, California.
But you have
And
patients from all over the country, all
all
over the
over
world.
the country, absolutely.
Yeah, absolutely.
It's my
Dr.
honor to be
Erfani,
here.
thank you
Thank
so
you.
much for being with us. Up next, we're going to talk to